Step 1. Please refer to inclusion and exclusion criteria prior to proning. Gather necessary help and supplies. Apply Mepilex on proper location as illustrated. For manual proning, you need a RT on head of bed, 3 turners on the left, and 3 turners on the right. Ensure everybody in the room is wearing Anaheim Regional approved PPE prior to this maneuver. For patients who might require proning should be line management. Consider them to be pointed towards the head of the bed. Foley catheters should be taped to the posterior medial aspect of the thigh. If any surgical drains are in place, ensure that they are secured to the posterior lateral aspect of the chest. Anterior chest tubes are contraindication in proning. Please make sure patients have been off feeding for 1 to 2 hours prior to proning. Please ensure that the patient is hemodynamically stable for actual proning maneuver. When proning patients, neck cannot extend backwards and needs to make sure that you create a seat collar using your arms to secure the head during the maneuver, which is usually the RT's position. Not illustrated in this video, the gown should be removed prior to proning. Anterior EKG leads should also be removed and reapplied posteriorly after the patient is proned. Ensure that the bed sheets are as wrinkle-free as possible. After the patient is placed back to supine position, we reapply another sheet to cover the patient prior to placing the pillows. After placing the pillows, always turn the patient towards the vent. We will place 2 pillows on the chest, 2 pillows on the hip, and 2 pillows on the shin. Proning and why we do it. The endothelial damage to the lung causes it to fill up with fluids, causing ARDS, which then drains to the posterior aspect of the lung. Fluids in the lung increases its weight, which squeezes out the gas in the dependent regions, which is the back of the lung in supine position. Shifting of lung densities causes an increased recruitment of dorsal alveoli for better perfusion. PEEP can also act as a counterforce to compressing pressures in the dependent lung. Once the pillows are placed, we can then apply a sheet on top of the pillows as taut as possible. The turners on both sides of the bed should tug on all 3 sheets and align them as best as they could. We can then fold all 3 sheets inward as illustrated in this video. At this point, the RT will ensure the ET tube line is verbalized and secured prior to proning. The RT at the head of bed will count down to coordinate when the turners will slide the patient up and away from the ventilator prior to proning. During the turning phase, the turners on the ventilator side will push the patient in, underneath, while the turners on the opposite side will pull the patient up and towards the ventilator. During this transition, the turners will keep one hand on the original position while they use the other hand to search for the opposite rolled sheet to grip. This position will be held while the RT re-inspects the lip line and ET tube. The RN reviews the IV and essential line placement. Another countdown will then be initiated by the RT when the patient is ready to be fully proned. Once prone, the patient needs to be realigned to the proper position where the head ET tube is properly placed on the prone pillar on top of the head. The person at the head of the bed needs to make sure that they are stabilizing the neck by making a C-collar out of their arms, while another RN will reposition the prone pillow to secure the ET tube in the patient's head right side up. Once the patient is prone, we can then reposition the patient with one arm up by the head, palm down, and one arm lateral to the body on a pillow. The RT will then again verify the ET tube placement, while another RN will verify all the line placement and securely fasten them prior to positioning the patient to the Verstern-Dellenberg. We can also apply the EKG on the back of the patient, mirroring that of the anterior placement. Once the patient is ready to be repositioned back to supine, or simply just repositioning the head, we will be using the same method that we did with the prone team by adjusting the sheets, placing the patient's hand lateral to the body, and ensuring that we properly secure the ET tube and the IV lines during this repositioning phase. During repositioning, we will use this method where we apply the sheet on top of the patient, roll towards the patient. If we need to reposition the head, we will pull the patient up while the RT securely holds the neck and reposition it appropriately. During prone to supine phase, we will go ahead and adjust the patient towards the vent and turn them away from the vent. During this transition, the RT will secure the neck in a C-collar position, while the RN can verify the line placement as well as the ET tube placement. We can then remove the sheets and the pillows for later use. Proning can be challenging, but if done correctly, can prove to be extremely beneficial and even life-saving for the patients who require it the most. And I want to thank everyone in Anaheim Regional for participating and improving patient care one day at a time.